Thank you for joining Drug Free Workplace PA. Today, we will discuss the cost of substance use in the workplace, addiction is a family disease, and creating a drug free workplace and resources. Substance misuse is using a substance to modify or control mood or state of mind in a manner that is illegal or harmful to oneself or others. Substance use can lead to accidents or injuries to self or others. It can lead to blackouts when you can't remember chunks of time when you were drunk or high. It can lead to poor physical health as you are at an increased risk for high blood pressure, stroke, cancer, liver disease, and other health conditions. It can also lead to poor mental health with the inability to concentrate, forgetfulness, depression, anxiety, and paranoia. It can also lead to poor job performance by missing deadlines, increased absenteeism, accidents, and injuries on the job. And it can also lead to family problems. 38 to 50% of all worker compensation claims are due to substance misuse in the workplace. Employees who are impaired from a substance file 3 to 5 times as many worker compensation claims than those who do not use. Substance users incur 3 times higher medical costs than non users. Substance users are 2.5 times more likely to be absent 8 or more days a year. Substance impaired employees function at approximately 67% of their working potential, and an estimated 80% of substance users supported their drug use by stealing from their place of employment. Many people think that people who use illicit drugs or misuse drugs and alcohol are not employed, but the reality is over 70% are employed. It is important to note binge drinking is having 5 or more drinks in a 2 hour period. According to the American Cancer Society Guideline for Diet and Physical Activity for Cancer Prevention, it is best not to drink alcohol. People who choose to drink alcohol should limit their intake to no more than 2 drinks per day for men and 1 drink a day for women. The most common illicit drugs used among employees are marijuana and cocaine. Marijuana is still a federally illegal drug, and it is still illegal in Pennsylvania to use recreationally. If an employee has a medical marijuana card, it should be addressed in the employee handbook policy. With that being said, being under the influence or impaired at the workplace is not appropriate and can result in discipline or termination. Refer to your drug free workplace policy with your employer. Some employees with substance use disorder are considered high functioning and are able to reach personal and professional success despite the substance use. However, high functioning does not mean healthy. More than 80,000 people die from alcohol related deaths each year in the United States. Over 15 million adults in the United States have alcohol use disorder or alcoholism. 40% of all hospital beds in the United States are being used to treat health conditions directly related to alcohol misuse. 1 in 13 working adults has alcohol use disorder. Shift work, such as overnight shifts and swing shifts, have been associated with binge drinking. 47% of industrial injuries can be contributed to alcohol use. Up to 40% of industrial fatalities can be contributed to alcohol use as well. Substance use impacts everyone in the workforce. Dangers are more obvious when an impaired person is operating heavy machinery, construction equipment, or driving. Substance use increases the likelihood of there being an incident or accident in the workplace. If coworkers feel like they are picking up extra work to compensate for the impaired employee, this can create resentment. Substances can impact the mood of the user, which in turn impacts the environment and morale of the workplace. Impaired employees put the company image and profit at risk, which can put everyone's job at risk. Impaired workers are not as productive as that of workers that are not impaired. Substance use impacts the ability to make logical, sound decisions. While not the obvious danger, clerical or administrative errors can create a risk to the company, profits, or operation. A risk to the company's organization's well being is a risk to everyone. Addiction is a family disease. Substance use disorder in families. 1 in 3 adults report substance use or addiction within their families. And 42% of employees admit being less productive or distracted at work due to substance use or addiction in their families. The impact may look differently depending on the family structure. Unhealthy or dysfunctional patterns of thinking, behaving, interacting, and trusting quickly develop within the family unit of someone living in active drug or alcohol addiction. The family tries desperately to adapt to the stress and turmoil associated with addiction. There are many common issues in an addicted family system. Everyone is affected to some degree, but some are affected more than others. The family unit can become stressed, tense, and hypersensitive. The stability of the family is greatly impacted. Finances can oftentimes be a major factor. Mental and physical health of family members can decline, and disorders like depression, anxiety, and post traumatic stress disorder are common family ailments. If children are living in a home where the parent has a substance use disorder, the children may take on the role of the parent and take care of the parent. Family members live with extremes. They live in fear of the unknown and what the future may hold. Family members believe they can fix their loved one through interventions, confrontation, or tough love. Some family members live with and contribute to a system of denial. It is easier to not acknowledge the problem and hope it goes away. Some family members become anxious, distrustful, and exhausted. Oftentimes, family members develop people pleasing and controlling behaviors. Families can become so focused on the individual that has the addiction that they do not or they forget to take care of themselves. The family member living in active addiction may manipulate situations in the home and cause arguments between parents and other family members to take the focus away from their addiction and their imminent need for help. And tragically, parents who live in active addiction have the primary need to fuel that addiction, and their children's needs become secondary. And in some cases, abuse and neglect can occur. The purpose of a drug free workplace provides a safe working environment. It also is intended to protect the employer's assets from theft and property. With a drug free workplace, you will have treatment for recovery through your employee assistance programming or other resources. It also promotes the health and overall well being of employees. With a drug free workplace, it provides training for supervisors and employees based on the Drug Free Workplace Act of 1988. Drug free workplace programs are not about a company's catching employees using drugs. Drug free workplace programs are about preventing employee drug use in the workplace. Employee drug testing is about a company's legal and moral obligation and responsibility to keep its workplace a safe and healthy environment for all of its employees, customers, and vendors. If your employer uses drug testing, it should be clearly outlined in your policy. A drug free workplace policy creates clear guidelines and expectations, and it encourages employees struggling to get help. A great resource is the Assistance Program. It is a component of the Drug Free Workplace Program. If your company doesn't have an EAP, your HR department and or health insurance should have resources available for you. An EAP is a confidential service provided by the employer or labor union to help employees and their families resolve personal or work-related stressors. There is no cost to the employee, and after EAP visits are exhausted, further services can be covered under the healthcare plan. It is a 24/7 confidential service. The information will not be shared unless the employee gives written consent. There is an exemption that includes threat of harm to self or to others. What if you suspect a coworker has a drug or alcohol problem? First, refer to your drug free workplace policy for guidelines. Do not try to solve the problem on your own. Share your concerns with management. Directly confronting a coworker can lead to denial, resistance, resentment, and tension in the workplace. If there is no policy in place, talk to management or supervisors about any suspicions they had, as they've been trained on how to proceed with any substance use issues. Most employers want to get the individual help instead of firing the employee. Do not keep quiet to avoid getting your coworker in trouble. This is a form of enabling and allows people to avoid the natural consequences of their actions, which can persuade them to seek treatment sooner. You are not the police. This should be approached with genuine care and concern for the health and safety of your coworker and the safety of others. Accommodating the person using a substance to protect him or her from consequences may not be helping the person. It is a natural reaction to want to protect a loved one or a coworker from the ramifications related to their drug or alcohol misuse. However, doing so may delay much needed treatment. Enabling is a way to accommodate the person who is addicted in order to protect them from facing the full consequences of their drug use. If your actions and words are helping someone maintain or continue in their addiction, then you are enabling. Enabling takes away the natural consequence of a person's behavior, which in turn takes away any motivation to change further, promoting a vicious cycle. It is important to establish healthy boundaries and take care of yourself when you're trying to help someone living with an addiction. Please visit our resources tab on our website for more resources that are downloadable for you to use. If you or someone you know or a loved one is in need of treatment, has questions, or just has an overall need for help, please call Pennsylvania Get Help Now at 1 800 662 4357. Thank you for joining us today.